Okay, our prone double leg raise test. This is another kind of core stability endurance test. We're looking to see, do we get a change in symptoms as we do this? So do we reproduce our low back pain? Does it get worse? And then how long can we hold this position essentially? So what the position is, laying down, all I want you to do, your hands can be out in front of you, can be down at the side, spread out. All we need to do here is raise our thighs off the table, right? So as long as our thighs are off the table, we're going to hold this position and we're going to see how long can we hold it. Go up to about 60 seconds, maybe a minute and a half if you can, and then you can go ahead and stop if we're not reproducing any pain. If at any point we start to reproduce pain or discomfort with this test, then we stop. We have a time at what that started to happen, and it tells us that hip extension and, again, creating a little compression in that low back starts to create or reproduce your symptoms. We also know that you may be trying to use those erector or low back muscles to create hip extension over using something like the glute or the hamstrings. So if you're someone that will bias erector spinae or low back muscles for that action of hip extension, which is a big action in the golf swing, then we know that if we start to work on the way you swing or the way you're creating force and the way that you know to create stability in that low back, we can take some pressure off that low back in things like the golf swing as well as exercise. Give it a shot.